Hi, my name is Allison. I'm a physical therapist here at CHOC Children's Hospital, and I am here to talk to you a little bit about what to expect after your surgery, show you how to get out of bed, some things that you're supposed to do and not supposed to do, and make sure that we can get you ready to go home. So the first day after surgery, when you meet the therapist, they are going to instruct you in precautions. Precautions are things that you are supposed to avoid doing to protect the surgery so that your back will stay straight as you go home. The three things that you're not supposed to do after surgery are bending, lifting, and twisting. To show you an example of this, when you're in bed and your knees are bent, you cannot let your knees fall to the side and keep your back straight because that's twisting your back. So you actually have to be able to roll your entire body as one unit so your back stays straight the entire time. The next thing that you will learn is how to sit up at the edge of the bed and how to move in bed. We're going to teach you what is called a log roll, and this is a way to move to keep your spine completely straight after surgery. We teach you this method so that you will be able to get up in your bed at home without the use of the rails or the bed coming up. To do this, we're going to start by bending your knees one at a time. With your knees bent, you're going to roll your entire body at one time. Once you're on your side, your therapist will help you swing your legs off the end and then come up to a sitting position right at the edge of the bed. Once you're sitting at the edge of the bed, your therapist will have you sit there for a few minutes to get your bearings, make sure that you're not dizzy and that your stomach is feeling okay. Next, we're going to teach you how to come to a standing position. Sometimes the transition going from sitting to standing can be painful, but if you push yourself through it and stand all the way up and tuck your hips underneath you, you'll actually feel better. When you're ready to stand, your therapist is going to have you scoot forward so your feet are flat on the ground. With your feet flat on the ground, you're going to lean forward slightly and push through your legs until your hips are underneath you and you're all the way standing up. After you're standing up, your therapist is going to show you how to get into a chair. This is going to be the same technique you're going to use if you're going to sit on a toilet. Once you're standing, you're going to take a step, turn your entire body as one, and as you go to sit down, you're going to bend your knees, reach your hands back, and slowly sit down. Before you go home, we'll make sure that you can walk and do stairs if necessary, and that your family will be able to help you with whatever you need. And if you have any questions, make sure that you ask your therapist. They'd be more than happy to teach you all the things that you need to know before you go home.